Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain-Free with Dr. Marc Darrow from the Joint Rehab and Sports Medical Center in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor, board certified through his studies at UCLA, and Dr. Darrow uses stem cell and platelet-rich plasma therapy to heal your body. He teaches about the use of stem cells, PRP, and prolotherapy. Today's program could open up a new life without pain for you. Now, here's Dr. Darrow with his co-host, Nita Valens.
Hi there, Dr. Darrow.
Nita Valens, are you living it up today?
I am. Are you?
I am. I was just looking at A New Way to Age, which is a book by Suzanne Somers. I think it's her 25th book that she's written. It's crazy. Yeah, from actress to a person that has helped so many people with natural healing. And I'm just looking through, I don't know if you have a copy of that with you, if you ever read it. But the stuff that she talks about is just amazing. You know, bioidentical hormones, how do you heal orthopedic injuries without surgery, without medication. That's what we do here. And she has a chapter in here all about Marc Darrow, page 302. It's a long chapter. And thank you, Suzanne Somers. This is a great book. You can get it on Amazon. I think it'll teach you all about your health and how to stay away from doctors if you can. I always tell my patients, I say, stay away from doctors if you can help it. And they go, even you? I go, even me. Always do the most conservative thing that you can in order to be healthy and to heal yourself. And today we're going to talk about what's called regenerative medicine, which is a practice I've been doing for over 25 years. I learned about it during my residency at UCLA, back in the dark ages, you might say. And it's morphed quite a bit since the old days. Regenerative medicine in the old days was called prolotherapy. Prolotherapy is proliferative therapy or proliferation of new tissue. So what we've been doing all these years is instead of masking pain by using medication, instead of cutting tissue out by using surgery, what we do is we do injections that stimulate new tissue to be grown. So getting into this, Nita, I'm going to give out the phone number to the studio right now.
Okay.
Because I don't want to just blab on my own. I'd like to be challenged by all of you listeners. Ask me questions. Ask me about your orthopedic pain. What does that mean? Tendons, ligaments, joints, neck pain, back pain, arthritis, anywhere from the top of the head to the bottom of the feet. So the phone number here, 866-870-5752. I'm going to repeat it a couple of times while you grab your pencil. 866-870-5752. 866-870-5752. We also have a website that has videos of me doing all of these procedures using your platelets or stem cells, or both mixed, and that website is amazing. I work on it every single day. It's got a slot on it on every page to email me. I hope you're not too shy to call in, but if you are, you can use a fake name, don't worry, or say it's about your brother or your sister, your friend, instead of you. But the website is www.jointrehab.com, www.jointrehab.com, and there's videos on every page watching me do these procedures. See if it's something you think is a good idea. It's very conservative. You walk in the office, you get injected, and you walk out. You don't need someone to drive you. The risk of infection is absolutely minimal. I can't remember ever infecting anybody doing these procedures. So, I see all kinds of terrible sequelae. Those are things that happen to people when they weren't expecting them, bad things after surgeries. So I was in line to study orthopedic. I was studying orthopedic surgery and to become an orthopedic surgeon. And I had my boss cut my shoulder because I was having pain. It came out bad. I had a very, very bad surgery. The surgeon was good. It's just these surgeries hurt people sometimes, and I was one of them. So that was a wake-up call for me that I was not going to be a surgeon and that I was going to do regenerative medicine because I injected my own shoulder after 4 years of misery after a bad surgery. And voila, overnight my shoulder was healed completely. Doesn't always happen like that. It worked on my wrist like that, about 50% better overnight. Later down the road, I injected my knees and then my shoulders. What else? Both shoulders, elbows, right wrist. I had other people do my neck and back for me, my friends. And it's nice when I have someone who's a friend who does regenerative medicine, because when they're injured, I can help them. When I'm injured, they can help me. But most of the injections I've done myself on my own body. And people freak out and they go, how could you inject yourself? Well, my mentor, an orthopedic surgeon, used to inject himself. And I said the same thing. How can you do that? And he said, well, when you got to do it, you got to do it. And my wrist was my first area I injected. The first time I was a little quizzical about doing it. But after that, and I saw the healing take place, I just figured it's one of those things you just do. You know, you do it. You don't think about what you're doing as much as the results that you get. And for a lot of my patients, you know, there's people that come in and they say, I'm needle phobic, you know, meaning they're afraid of getting injections or even looking at a needle. And then I decide for them and help them make their decisions. Would you rather get a surgery where you're going to get injections anyway, you know, to calm you down, to put you out, and then get cut, and then who knows what the sequelae will be afterwards? I see way too many people that come in the office after a failed surgery. That means one that was supposed to come out good and came out bad. And then we can do regenerative medicine on them also. So once again, the phone number to the studio, talk to me live. Ask me your questions, 866-870-5752. If you're driving, please, it will help you. It'll be safer to pull over to the side of the road, get off of your Bluetooth so we can hear you best. And for those of you that want to talk to my staff, if we miss something on the show, you can call my office anytime, 800-300-9300. That's 800-300-9300. So let me go to, unless you have something to say, Nita, I'd like to, actually I do have one more thing to say.
Okay.
If you call us now at 866-870-5752, you will get a free copy of my book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. It's a couple hundred pages long. It's got over 250 studies in it on how stem cells and platelets work and how surgery is really the last option that you can consider. I know our culture is to jump right into surgery. I have 5 children, and some have been college athletes, and it is sort of the culture when you get injured to get a surgery. And I've had to do everything in my power to keep them from having surgeries. And thank goodness they haven't had the surgeries, because most of these surgeries shouldn't be done. That's according to me, Marc Darrow. I'm not saying what the right thing or wrong thing is, but according to me, I see way too many people get these surgeries and they fail, and then the person has less tissue available, and the next time they're injured after a surgery, then what happens? You know, the first, it might be a meniscal tear repair, or cut the meniscus out, and then what happens the next time there's an injury? Maybe a knee replacement. You don't want to go there, folks. I see too many of those things that just come out very, very bad. So, Nita, anything before I take some questions here? Do you want to pipe up and have a say-so here?
Well, I think it's really important for people to call in and at least get the free book.
Yeah, it's a free book. I even pay the postage. You can't go wrong with that one, can you?
No, perfect.
All right, I'm going to go to a person who inquired through the website. It says pain in both knees and golfer's elbow. Okay, I wonder if that person's a golfer. Well, basically, they just said the same thing. I have pain in both knees and golfer's elbow in my right arm. So the fact they know it's golfer's elbow might mean that they're a golfer. And I'd say I'm making up a number, maybe 20% of my patients are golfers. I seem to be a golf magnet, maybe it's because I play golf. And I can tell you from being a long-time golfer, even though people think golf is not a sport, they think it's a game, go out and try it. You're swinging a club at 100 miles an hour and hitting the ground and all kinds of things. My first injury that I had was my right wrist from hitting the ground when I wanted to get a ball up high in the air. You know, the whole thing of opposite and equal reactions in physics. You hit down, the ball goes up. So I hit the ground with a 3-wood trying to get the ball over a tree. And I hit the ground. I didn't hit the ball. Hyperextended my wrist and had very severe right wrist pain. All my orthopedic buddies wanted to either give me a steroid shot, and all of you who listen to me know this. Steroids like cortisone destroy tissue. They destroy cartilage. If you don't believe me, look it up. Just put in a couple words in Google. One is cortisone, the other is cartilage. If you read that, you won't want to get one of those shots. Others offered me surgery. I refused all of that, and I learned how to do this myself. I injected my own wrist and healed it up myself. That was back in the old prolotherapy days of injecting highly concentrated dextrose into the body to create an inflammatory response, which brings fibroblasts to the area, which are cells that stimulate growth. They actually grow new tissue. And in my first book on prolotherapy, which was done years and years and years ago, there are graphs and photographs of new tissue growing from injection with just something as simple as dextrose, an irritant. Back in the day, we also used things like sodium moreuate, which is fish oil concentrate, or zinc sulfate, and those things hurt pretty bad. I did my elbow with it one time because I had tennis elbow on both arms, and as soon as the needle got into the tissue, it was burning from using sodium moreuate. I had a stiff arm for 2 weeks, and I didn't know who to turn to because most of what I learned was intuitive back in the day. And I was pretty terrified. And then I woke up one morning about 2 weeks after the injection, and my elbow was completely healed. So back to golfer's elbow, that means the medial epicondyle, the middle epicondyle on the elbow. And these words that I use, please look up on Google, write them down or go to your computer and Google them. And you can see the anatomy. And if you want to put the words in, and then what comes up will be a image either in the Google search, or there's a spot on the upper left-hand corner when you Google that says images. Click on that and you'll see the actual anatomy. So anatomically, golfer's elbow is called medial epicondylitis. Okay, so inflammation of the epicondyle in the middle part of the elbow. Tennis elbow is called lateral epicondylitis. Okay, different muscles pulling on the tendons which attach to the bone. So those things are very, very easy to fix. I've been injecting those for 25 years in patients and had very, very amazing success. One of the first ones was an actual tear in the tendon of a very famous music lawyer. And he played a lot of music, and he came in because and he played tennis, a lot of tennis. So he came in, we got an MRI, he had a tear, and we healed him up. He wasn't able to play guitar. He was a great guitar player and a great musician, because just the pressure of having that guitar hanging around his neck, pulling on his arm, stopped him from playing. So we got him better. I get a ton of musicians that have a medial epicondylitis or lateral epicondylitis from overuse. Musicians, in order to be good, play things over and over and over and over. Tennis players, in order to be good, got to hit that ball over and over and over and over. Golfers, over and over and over and over. So those are what we call overuse syndromes. And believe it or not, golfers seem to have some of the worst injuries of anybody because they keep playing even when things hurt. So they get neck pain, back pain, you name it. They get meniscal tears in the knees. They get rotator cuff tears in the shoulders. They get arthritis in the fingers and the toes. So yes, you golfers out there, be careful. I tell everyone, stay away from hitting too much at the range, at the golf range, because you get so repetitious that you're going to break down areas. And I'm at fault too. I've done it. I'm the kind of guy that's so repetitious, I'll hit one shot for an hour just to get it down right. I'll go into the sand trap and I'll hit one shot for an hour straight. That's not good on my body. It's not good on your body. But, we're crazy athletes. What are we going to do? But the best thing in golf is play. Don't really do repetitive things over and over. And especially do not hit off of mats. If you're going to go to the range, take a small bucket of balls and hit off the grass. And if you go to a range where there's only mats, then try to go to the ends of the mats where there is some grass or dirt and hit off of there. Hitting on mats is not good for you because the mats typically are very firm. You hit great off of them. People play better off mats than they do off of grass. But there's often cement under them, and that ball is getting right down into there with that club and yanking your arms and shoulders and knees and everything else. So yes, very good success with regenerative medicine, using platelets or stem cells on golfers and tennis elbows. This person also states they have pain in both knees, and golfers get tons of pain in their knees. There's a squat action during what's called transition. When the club comes back on the backswing, during transition to hit the ball, there's a squatting motion, and the knees take a lot of pressure. So I end up with a lot of patients in my office who have meniscal tears and in the knees. And often they come in, I look with an ultrasound. Make sure your doctor uses an ultrasound because you got to look inside to see what's going on. And if there's fluid in the knee, I can use that ultrasound to guide the needle to get every drop of it out without hurting you at all. When I aspirate a knee, I numb it up first. There's no pain to it. And I'm not searching for fluid. I can see it, so I'm not scraping bone or cartilage. Most people who have had knee aspiration have said it's horrific pain. And then when I do it for them, they go, God, that was like nothing. Be careful if you ever have a Baker's cyst that's fluid in the back of the knee to make sure your doctor uses an ultrasound because there's a big artery and vein back there and a nerve, and you don't want them to inject blindly. You never want your doctors to inject blindly in dangerous areas. So, Nita, I'm going to give out the phone number again. We
that
need
would
some
be an
callers.
awesome idea.
Either that or I'm going to have to ask you some jokes and then put you on the spot. And I know you hate that, and I know your audience loves calling in to get you off the hook. But anyway, the phone number to call us right now is 866-870-5752. I'm going to repeat it. Grab your pen. 866-870-5752. If you want to, here we're just getting a caller coming in. See, they didn't want you to get the jokes.
Thank heaven. They are rescuing me.
But I'm going to ask you one quick joke, okay? What do clouds wear under their shorts? Thunder pants.
Thunder pants? Is that what you said? Oh, that's a good one. That's a good one. I like that one.
But you didn't laugh, so you get one more joke. You ready?
Yeah, I think so.
How many tickles does it take to make an octopus laugh?
100.
Tentacles.
Oh, my God. That's a good one.
You didn't laugh. You get one more.
Okay.
Here's one I don't understand. I'm going to delete it.
Oh, no. I'll never get it if you don't get it.
Okay, here's one. This is kind of hard, but
Okay.
Nita, you are a genius.
Oh, right.
How did the hipster burn his tongue?
How?
He drank his coffee before it was cool.
Okay, that's not that funny.
It is funny. Hipsters are cool.
Okay. All right. Oh, look, Virginia's here. Yay.
All right, Virginia, Dr. Marc Darrow. Your brother's knees and your husband's hips. Let's talk about a hip first. What's going on with the hip with your husband?
I do not wish to talk on the radio, but I thank you for the opportunity. Can I
Thank
help
you. I won't embarrass you. I'm going to love you, so it won't be a big deal. How long has your husband's hip bothered him?
approximately several months.
Okay. And did he go to a
We're
doctor?
talking about hip surgery. He's talking
okay.
about hip surgery. So
Okay.
I thought.
So he did go to
might-
a doctor, and they probably got an MRI or an X-ray and said you've got arthritis, so you need hip surgery, correct?
Yes.
Okay. Can your husband walk around?
With a cane and without a cane, yes.
Okay. And
it's
how
just a
old is
matter
he?
of he's 80.
Okay. 80 years young, I call it. I'm on my way. So I get a lot of people who come in ready for a hip surgery. They've been told by several different orthopedic surgeons they need to get a hip surgery. And first of all, we got to delete the word need, because nobody needs a hip surgery. Nobody needs any surgery unless it's life-saving. Then I say you need it, okay? So in this kind of case, Virginia, I need to examine him and see how he walks, see what his range of motion is in that hip joint, and see what his pain level is. And most likely in someone like that, we'd want to do platelets and stem cells mixed together and help grow back some cartilage and help him get rid of his pain. And I can't really tell you a whole lot more than that, other than way too many people get hip surgeries and come out worse. I had someone that had that done. He called me up months later, apologizing, saying, I know you told me not to do it. I did it, and now the joint has failed. It's infected. I'm in the hospital. What should I do? You know, it's too late then. So it's always best to be conservative. Do all the conservative things you can. And regenerative medicine, using platelets and stem cells, is super conservative. It's natural. It's easy. It's just an injection. You walk in, you get injected for the hip under ultrasound guidance. You can watch where the needle goes and hopefully get some healing. Do you have any other questions about your husband and his hip?
No. So where is your office?
I'm in West LA, across the 405 on Wilshire Boulevard, across from UCLA, my alma mater.
Oh, his alma mater too.
Oh, good. Well, we'll get along good. Now tell me about your brother's knee. What's up with that? How old is your brother?
He's 66.
6'6"?
Yes.
Okay. Do you know about Route 66? Used to be a famous TV show. It's a good age to be. 66 is very young these days. People are getting a lot older and feeling great. So how long has your brother's knee bothered him?
Just forever. And he had knee surgery on the other knee, and that was so painful recuperating from that he just won't consider having surgery on the second knee.
Okay.
And
okay. Well, look, you know, I'm just going to say it the way it is, like me or dislike me. I don't like surgery. That's just the way it is. Mm-hmm. I've seen, you know, I did lots of surgeries in my training, and I'm not an orthopedic surgeon because after my shoulder was pretty much ruined for years after a surgery that I had done on it, I jumped horses midstream and got out of orthopedic surgery and went into what's called physiatry, physical medicine rehabilitation. And I learned about regenerative medicine. I've been doing that for the last 25 years or so with amazing success. And listen, I fight with my buddies who are orthopedic surgeons. They say I'm an idiot, and I say they're an idiot. They say what I do can't work, and I say what they do hurts people. So we get along, but we argue. And the nice thing about what I do is I don't think there's really many failures in what I do. The biggest failure is when people don't do enough of it. There's reasons for failure in anything. One is the doctor doesn't use, or the nurse doesn't know what she's doing or he's doing. The doctor doesn't know what they're doing. They don't use an ultrasound to guide the needle to look inside the body. Patients are taking anti-inflammatory medicines that block the healing, or the patient has too much activity. Let's say they're a golfer, which we were talking about before, and they don't let it rest. They go back and play golf after an injection. That ain't going to work. You know, if you're beating something up and you're trying to heal it, don't beat it up some more. Hey, Virginia, would you hang with us? I'm going to get into this more, and we're going to the break. Chuck, please stay with us, and all your other callers, we're going to get to you.
Okay, this is Living Pain-Free with Dr. Marc Darrow. I'm your host, Nita Valens, and we'll be right back after these messages.
You're listening to Living Pain-Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned.